Donning and doffing of PPE. Meticulous donning and doffing of PPE is a vital step in reducing contamination of healthcare workers caring for patients with transmissible infectious diseases. This is critical to mitigating spread and maintaining the healthcare workforce. Steps in donning of PPE. Step 1. Perform hand hygiene. Performing hand hygiene is an integral step into breaking the chain of infection. Step 2. Put on gown. Having a gown on provides protection of skin and personal clothing from incidental contact and small splashes. Step 3. Put on hairnet. Hairnet or hair caps prevent cross-contamination and human contamination within the lab. Step 4. Put on surgical mask or respirator. Surgical mask or respirator helps prevent the spread of infection and prevent the individual from contracting any airborne infectious pathogens. Step 5. Put on protective eyewear or face shield. Face shields provide a high level of protection for the wearer. Lastly, Step 6. Put on gloves. Surgical gloves or sterile gloves help prevent surgical site infections and reduce the risk of exposure to blood and bodily fluid pathogens for the healthcare worker. Note that proper donning of gloves is also important to preserve the sterility of the gloves as well as mitigate the spread of infection. Steps in doffing of PPE. Step 1. Remove gloves. It is important to never touch the outside of the glove where it is considered as contaminated. Remove the gloves from the inside out. Step 2. Perform hand hygiene. As a precautionary measure, it is best to perform hand hygiene right after removing the gloves. Step 3. Remove gown. When removing the gown, make sure to remove it by only touching the insides. Step 4. Perform hand hygiene. It is recommended to perform hand hygiene every after a protective equipment is removed to provide the highest level of protection to the healthcare worker. Step 5. Remove hairnet or hair cap. Step 6. Perform hand hygiene. Step 7. Remove goggles or face shield. Step 8. Perform hand hygiene. Step 9. Remove mask or respirator. Note, when removing mask or respirator, only touch the loop of the mask. Lastly, Step 10. Immediately perform hand hygiene. Note that in doffing of PPE, whenever protective equipment is removed, it is disposed immediately according to its appropriate color-coded bin.